Before you rush to get an MRI for your knee pain, you need to hear this. Because the truth is, many runners with perfectly normal knees show scary things on MRI, and many runners with serious looking scans have zero pain. In this video, I'm going to show you why MRIs are not always needed and how you can get rid of your knee pain and enjoy running well into your 60s and beyond. So, why runners get stuck waiting for imaging? I get it. Up to 47% of runners every year experience some type of knee pain, whether they're marathon runners, ultra runners, etc. And many immediately think that they need an MRI, right? So they stop exercising altogether. The thing is, yes, MRIs can show things like degeneration, inflammation, meniscus changes, cartilage changes, but that doesn't mean it's always the cause of the pain, right? There's this idea that tissue damage equals pain, but just because you have something changes, it could just be normal age-related changes. Right. And many people with zero knee pain show meniscus tears on arthritis on imaging. Again, because these could just be normal age-related changes. Kind of like you get wrinkles in your skin, your cartilage just starts to show normal signs of age-related wear and tear as you get older, especially if you're 50, 60 years old. You're going to have some wear and tear, some cartilage changes, some meniscus changes. Doesn't mean that that meniscus tear on the imaging is the cause of your knee pain. It could just be an incidental finding. All right. And, this fear of like causing more damage to, the knee causes many runners to stop moving altogether. Right. And there's actually a term called kinesiophobia where people stop moving their bodies. They're very overly protective, or maybe they maybe they'll move a little bit like within their comfort zone. Like maybe they'll jog, but they're afraid of pushing the pace because they're afraid they're going to get hurt or re-injure or flare up the area. And, in some cases, that's warranted. If it's like a severe enough pain where you're like limping, you had obvious trauma, like let's say you fell down, twisted your knee, right? Or you're in a car accident or something, or a skiing accident. Yeah, obviously go to the doctor, get it checked out. But if there's no obvious trauma, you just, went for a run and then your knee started hurt a little bit, it doesn't mean that you have to like go rush to get advanced imaging, right? If you didn't have like some major fall or anything, or obvious trauma, a lot of this type of knee pain can be addressed with conservative management, right? Waiting weeks and weeks and weeks to get imaging and not even wanting to do any movement at all, not even wanting to do rehab or physical therapy, the knee becomes weaker and more sensitive to load. Then when you try to like pick up running again, you're like, oh, I'm just going to rest for a month, and then you're going to try to pick up running again. You may feel good for, on an easy run, but then it flares up the minute you go on a long run or a speed run, right? Because you're overly protecting the knee and you actually allow the knee to get weaker. So, and if you want to get more information on this, there's actually research studies, right? Unnecessary MRI of the knee, how much is it really costing? You can look up these research papers, prevalence of abnormal finding in 230 knees of asymptomatic adults. Asymptomatic just means pain-free. So you could feel free to look up these research articles here if you want to look at the science. And if you want to copy this Google Doc to learn about running without knee pain, I'm sharing it inside my free online run group. Click the link in the description to join. So what actually fixes most running knee pain? You have to get a thorough physical exam to identify the real driver, whether it's the joint itself, the muscles around the joint, the knee, the hip, or the spine. And in fact, about 25% of knee pain is actually coming from the back. So that's really important to get a proper mechanical assessment to really understand what's driving the pain. Because if you just start doing random exercises, right, like, oh, I'm just going to go on Google or YouTube, oftentimes you're just guessing, right? Without an assessment, you're just guessing. So it's very important to get the proper assessment. So even if I show you some exercises here, they might not be applicable to you, right? Because just because you have knee pain doesn't mean that it's the same as every other person's knee pain. Again, it may respond to different types of exercises. The right exercise matters. Now, I will show some sample exercises here, right? But again, a big caveat, without an assessment, this is kind of more like generic advice here, generic tips. But anyhow, with, let's say, it is truly, let's say, a knee pain that it's coming from the knee or the muscles around the knee, oftentimes you can strengthen it with the right exercise. For example, knee extensions, sit to stands, box squats, step ups and step downs. And then again, if it's coming from somewhere else, like let's say it's the hip or the lower back, then you obviously have to either do exercises to address the hip or the back, like back mobility exercises or hip mobility or even hip strengthening exercises when applicable. So you gradually want to rebuild your strength, mobility, and then ability to tolerate loads. So running is high impact, so ability to tolerate like jumping, heavy squats, heavy lifting, etc. So you know that you're safe to return to running. So some of the sample exercises here, we got like step downs, sit to stands or box squats, seated leg extension. You can also do this with a machine or with ankles weight or with bands. So different variations. Again, you do need a proper assessment though. So instead of just like, oh, I'm just going to try to do it myself. I know many of you watching this probably going to ignore me and try to do it yourself anyways. That being said, if you're stuck with pain and it's not improving, right, it's been a few weeks, you've been trying to do it yourself and it's, been 2 weeks, 3 weeks, 4 weeks, right? It's been a whole month. You trying to do it yourself. But I still recommend getting it checked out within 2 weeks. But if within 2 weeks, if nothing's happening, right, get it checked out because you should see some gradual improvement every 1 or 2 weeks, at least every 2 weeks, some improvement. If you're not getting improvement, work with a physical therapist, or a sports medicine doctor, whoever, to help you, finally get rid of this pain that's bothering you. And because you shouldn't have to be dealing with pain, right? Having pain during running doesn't have to be normal. You could actually run and not be in pain, right? So what happens when you treat the cause? Many runners improve in about 6 to 8 weeks with the right exercise plan. Pain decreases and the knee gets stronger and tolerates load again. And oftentimes you could avoid surgery, injections, and pain meds. Oftentimes, surgery is not necessary, right? I personally rehabbed the meniscus tear without surgery and returned to be able to run and run pretty fast as well. And I've also helped runners who were scheduled for surgery, like maybe they were told to do PT like a month or two before surgery, or they're thinking about it. We were able to cancel the surgery and just strengthen their knee and avoid surgery altogether. So I've helped runners in their 50s, 60s, and beyond, right, get back to running pain-free. So I currently have 2 spots open to work with me privately for one-to-one coaching to help you run pain-free, or if you just want to improve your performance, also help folks want to run faster for longer. If you're curious, there's a link in the description. First come, first serve. So the real lesson about MRIs and knee pain. MRIs show structure, not the true cause of pain. Movement and a proper assessment tell you far more than a scan alone. Most running-related knee pain improves when you identify the real driver and unload the tissues properly. So stop waiting for permission from a scan. Start strength your knee actually needs.